Assalamu alaikum. Today we are going to learn about how to prepare patient for ABGs test. An arterial blood gas test is a blood test that requires a sample from an artery in a human body to measure the levels of oxygen and carbon dioxide in the blood. The test also checks the balance of acids and bases, that is known as the pH balance in the blood. In this session, we only go through the normal values of arterial blood gases. These values include oxygen content that should be 15 to 23% per 100 ml of blood. pH level 7.35 to 7.45 considered as a normal. Partial carbon dioxide normal range value lies between 35 to 45 mmHg. Partial oxygen 80 to 100 mmHg, bicarbonate 22 to 26 milliequivalent per liter, oxygen saturation 95 to 100%. There are few steps involved in drawing ABGs appropriately, and this practice promote nurses' competency and make it easy to proceed. Step 1. Wash your hands, introduce yourself to the patient and clarify their identity. Explain what you would like to do and obtain consent. This is a slightly uncomfortable procedure, so you should let the patient know this. Step 2. Gather the necessary equipment, a blue needle, 2 ml syringe with heparin, a cap for the syringe, a plastic bung, local anesthetic, plus needle and syringe for giving alcohol gel, gauze, gloves, a sharp bin. In step 3, position the patient's arm with the wrist extended. Step 4. Locate the radial artery with your index and middle fingers. Perform Allen's test where you compress both radial and ulnar artery at the same time. The hand should become white, release the ulnar artery, and the color should return to the hand. This ensures that there will be a blood supply to the hand and it should not be cause blockage during the ABG's procedure. In step 5, put on your gloves and attach the needle to the heparinized syringe. Prepare your local anesthesia if needed and give a small amount over the palpable radial artery. In step 6, tap the cap of the needle, flush the heparin through the syringe and again locate the radial artery using your non-dominant hand. In step 7, let the patient know you are about to proceed and to expect a sharp scratch. Insert the needle at 30 degrees to the skin at the point of maximum pulsation of the radial artery. Advance the needle until arterial blood flushes into the syringe. The arterial pressure will cause the blood to fill the syringe. Remove the needle or syringe, placing the needle into the bung. Press firmly over the puncture site with the gauze to halt the bleeding. Remain pressed for 5 minutes. In step 8, remove the needle and discard it safely in the sharp bin. Step 9. Cap the syringe, push out any air within it, and send immediately for analysis, ensuring that the sample is packed in ice. Remove your gloves and dispose them in the critical waste bin. Wash your hands and thank the patient. Conclusion. An extension to this station may be arterial blood gas interpretation. Before attempting to interpret the result, nurse should know whether the patient was on room air or on oxygen when the sample was taken, and if the patient on oxygen, what was concentration of the oxygen. It is also helpful to know whether the patient has a temperature or not, and this should be clearly written on the sample. These are references, and thank you for listening. And if you like it, share and subscribe. And if you want any other session, you can comment in the box below. Take care.